Close the curtains for patients' privacy, perform a hand hygiene to prevent the spread of microorganisms, and don gloves to prevent the spread of germs and contamination. Remove all sheets, blankets, and the gown from the patient. Remove any drains, tubes, and jewelries. Next is close the patient's eyes and mouth. Give the bed bath like you would if the patient was still alive. Just because they can't feel anything doesn't mean you shouldn't be thorough or should be extra rough on them. The rationale of this is to prevent infection, hygiene maintenance, and patient's well-being. Cotton balls on patients' closed eyes, in the nares, and in the outer ear. Then secure each with a tape lengthwise. Secure the patient's jaw in a cravat.
Ma'am, gusto niyo po bang makita or makasama yung patient? Gusto niyo po bang mag-isa? Okay pa.
Apply name tag on the foot. Cover and secure the patient with the shroud. The shroud with safety pins and secure another name tag on the shroud. Remove gloves and materials and do hand hygiene. Order for the type of cold application, the location, duration, and the site temperature, to review the client's medical history and contraindications that may prohibit the use of cold therapy. Next is to prepare all the materials needed, perform hand hygiene before the procedure, don gloves, for patient's privacy. Assess the patient's vital signs. Treat the client and expose only the part that is being treated. Put the waterproof pad under the patient's body part that is being treated. Provide warmth to the client by putting a blanket to avoid chilling. Put pillow under the patient's body part that is being treated. Fill the ice bag about 1/2 crushed ice and cover with towel. By bending or twisting the ice bag and secure it properly. Be sure to check if there's any leakage. Hold the ice bag and instruct the client to remain in her position. Monitor the client at the time of application and assist the client in terms of comfort and skin reactions. Leave the cold compress for only designated period and then remove. Discard the gloves and do hand hygiene. Document the application of cold compress and client's response. Verify order for type of noise, hit application location and duration, and decide temperature, review client medical history, and contraindication that may prohibit the use of hot therapy. Next is prepare all the materials needed. Close the curtains for patient's privacy. Don't forget to perform hand hygiene to prevent the spread of microorganisms, and don gloves to prevent the spread of germs and contamination. Introduce yourself and identify the patient and explain the procedure. Assess the client's vital signs and mobility. Verify the area where you intend to apply the hot therapy. Drape the client and expose only the part that will be treated. Put the waterproof pad under the patient's body part that will be treated. Place the water bag to the area that is being treated. Tell to the patient that you will leave it for 20 minutes and will check every 5 minutes. Assuming that it has already 20 minutes, so now I'm going to remove the hot water bag and remove all the materials used during the procedure. the procedure. Then lastly, document the application of the heat therapy. That's all. Thank you for watching.